Every year, millions of adults are diagnosed with diabetes, yet many remain unaware of early warning signs. Out of every 10 people, nearly 8 fail to recognize symptoms until the condition has already progressed significantly. In many cases, over 90% of diagnoses happen only after the body has already begun suffering damage. What is even more concerning is that some of the earliest signals quietly appear in your feet. Have you ever felt slight tingling, numbness, or noticed small changes in your feet and ignored them completely? Many people assume these sensations are just a normal part of aging and nothing serious to worry about. But what if these small changes were actually early warning signs your body has been trying to show you? As we grow older, it becomes easier to overlook subtle signals that may be linked to blood sugar levels. These quiet signs may also reflect changes in your nerves and long-term health conditions over time. Before we begin, I would like to ask where you are watching this video and what time it is now. Please leave a comment below and share your situation. I would truly love to hear from you today. If you find this video helpful, please take a moment to like and subscribe to support the channel. Sign number 1 is tingling, numbness, or burning pain in your feet that should not be ignored. This is one of the earliest and most common warning signs of nerve damage caused by diabetes. This condition is called peripheral neuropathy and often begins quietly before becoming more noticeable over time. Studies show about 1 out of every 2 people with diabetes will develop some level of nerve damage. The feet are usually affected first because the nerves there are longer and more vulnerable to damage. You may begin to notice a light tingling sensation, like tiny pins gently touching your skin surface. Some people feel numbness that makes their feet less sensitive to touch, pressure, or temperature changes. Others describe a burning or electric sensation, especially at night when the body is resting quietly. At first, these symptoms may seem minor or easy to ignore, but they are not normal aging signs. As nerve damage progresses, your ability to feel pain, heat, or cold may slowly decrease over time. This means you might not notice a small cut, blister, or even something uncomfortable inside your shoe. Without pain to warn you, these small injuries can quickly develop into serious infections if untreated. If you experience any of these symptoms, do not wait and speak with your doctor as soon as possible. Keeping your blood sugar within a healthy range is one of the most effective ways to protect nerves. This helps prevent further damage and reduces the risk of serious complications related to diabetes over time. Sign number 2, loss of feeling in your feet. This often happens after long-term nerve damage caused by diabetes. Over time, the nerves lose their ability to send clear signals, which means you may no longer feel pain, heat, or cold the way you should. At first, this may not seem like a problem, but it removes your body's natural warning system. Normally, pain alerts you when something is wrong. Without that signal, injuries can happen without you even noticing. For example, you may not feel a small stone inside your sock, a blister from tight shoes, or a minor cut on your foot. You could step on something sharp or walk on a hot surface without realizing it. Even something as simple as soaking your feet in water that is too hot can cause burns without any immediate pain. The risk becomes serious because these unnoticed injuries can turn into ulcers or infections. In people with diabetes, healing is often slower, and infections can spread more easily. In severe cases, this can lead to tissue damage and even amputation. To protect yourself, make it a daily habit to check your feet carefully. Wear shoes and socks at all times, even indoors, to reduce the risk of injury. Sign number 3, changes in the shape of your feet. This sign is less common, but it can be one of the most serious. Long-term nerve damage from diabetes can weaken the bones and joints in your feet without you feeling pain. One dangerous condition is called Charcot foot. It may begin with redness, warmth, and swelling, but as it progresses, the bones in the foot can shift, weaken, or even break. over time. This can change the entire shape of your foot, sometimes creating what doctors call a rocker bottom shape. You may also notice other changes, such as toes starting to curl downward or the appearance of bony bumps near your joints. These changes might seem small at first, but they can alter how pressure is distributed when you walk. This is where the real risk begins. Uneven pressure can cause thick skin or calluses, and these areas can quickly turn into painful ulcers. Once an ulcer forms, the risk of infection becomes much higher, especially if blood flow is reduced. If you notice any change in the shape of your foot, even slight swelling or unusual structure, do not ignore it. Early medical care can prevent serious complications. In some cases, special shoes or custom inserts may be needed to protect your feet and reduce pressure. Sign number 4. Wounds that heal slowly on your feet. This is a serious warning sign that is often linked to poor blood circulation caused by diabetes. When blood flow to your feet is reduced, your body cannot deliver enough oxygen and nutrients to repair damaged skin. As a result, even small cuts or blisters may take much longer to heal. At first, it may seem like a minor issue, but in people with diabetes, slow healing creates a much higher risk of infection. A small wound that would normally heal in a few days can stay open, allowing bacteria to enter and spread. In some cases, the infection may not fully heal without proper treatment. If left untreated, this can lead to more severe complications such as tissue damage, also known as gangrene. In the most serious situations, doctors may need to remove part of the foot or leg to stop the infection from spreading and protect your life. Pay close attention to any wound on your feet. If a cut, blister, or bruise does not begin to improve within a few days, do not ignore it. Contact your doctor as soon as possible. Early treatment can greatly reduce the risk of serious complications. Sign number 5. Changes in skin color and temperature in your feet. This is a warning sign many people overlook. You may notice your feet looking red, pale, or even slightly bluish. At the same time, your feet may feel unusually warm or cold compared to the rest of your body. These changes can be a signal that something is not working properly with your blood flow or your nerves. But one of the most important signs to watch for is what doctors call a hot spot. This is an area of skin that feels warmer than the surrounding areas. It may seem minor, but it can be one of the earliest signs that a blister or sore is starting to form under the skin. You should also be careful if you notice redness combined with warmth or tenderness. This can be an early sign of infection. The key is to pay attention to small changes. Your feet often show problems before you feel them. If you notice any unusual color or temperature differences, do not ignore them. Early awareness can help you prevent more serious complications later. Sign number 6. Dry and cracked skin on your feet. This may seem like a small and harmless issue, but for people with diabetes, it can become a serious problem. You may notice your skin becoming very dry, rough, or flaky, with small cracks appearing on the surface. These cracks are not just cosmetic. They can be dangerous entry points for bacteria. When the skin barrier is broken, germs can easily enter the body. And because diabetes often affects blood flow and slows healing, even tiny cracks can quickly turn into painful sores or infections that are difficult to treat. This is why daily foot care is so important. After washing and drying your feet, apply a thin layer of moisturizer, cream, or petroleum jelly to keep the skin soft and protected. Keeping your skin hydrated helps prevent cracks from forming in the first place. However, there is one important rule you must follow. Never apply moisturizer between your toes. Too much moisture in that area can lead to fungal infections. If you notice deep cracks, bleeding, or signs of infection, do not wait. Seek medical advice as soon as possible. Small problems can become serious very quickly if ignored. Sign number 7. Changes in your toenails. This is a warning sign that is often ignored, but it can reveal early problems linked to diabetes. You may notice your toenails becoming thicker, turning yellow, or looking uneven. In some cases, fungal infections can develop, especially between the toes, where moisture can build up. These changes are not just cosmetic. Thick or damaged nails can press into the skin, increasing the risk of cuts, ingrown nails, and infections. When diabetes affects blood flow and healing, even a small nail problem can quickly become more serious. Good daily hygiene is essential. Wash your feet and nails with warm water and mild soap. Then dry them carefully, especially between the toes. Keeping the area clean and dry helps reduce the risk of infection. When trimming your nails, always cut straight across and avoid cutting too close to the skin. Smoothing the edges with a nail file can help prevent sharp corners. If your nails become very thick, yellow, or start growing into the skin, do not try to handle it alone. Seek help from a foot specialist. Early care can prevent painful complications and protect your long-term foot health. Sign number 8. Hair loss on your toes or lower legs. This may sound surprising, but it can be an important warning sign. To understand it simply, think of your blood as the body's food supply, delivering oxygen and nutrients to every part of your body, including the tiny hair follicles on your feet and legs. When diabetes affects your circulation, blood flow to the lower parts of your body can decrease. As a result, these hair follicles do not receive enough nourishment. Over time, the hair becomes weak, stops growing, and may gradually disappear. You may notice that the hair on your toes or lower legs has thinned out or completely vanished, leaving the skin looking unusually smooth and shiny. Because this change is painless, many people ignore it. But this sign is important. If blood flow is not enough to support hair growth, it may also not be enough to help wounds heal properly. This increases the risk of infections and more serious complications. If you notice this change, speak with your doctor. Improving blood sugar control and supporting healthy circulation can help protect your feet. Sign number 9. Pain or cramping in your legs when walking. You may feel aching, tightness, or cramping in your calves, thighs, or even your hips when you walk, climb stairs, or stay active. What makes this different is that the pain often goes away when you stop and rest. This can be a sign of poor circulation, commonly linked to a condition called peripheral artery disease. In people with diabetes, blood vessels can become narrowed, reducing the flow of oxygen-rich blood to your legs. When you move, your muscles need more oxygen, but the blood supply cannot keep up, which leads to pain. This is not just discomfort, it is a warning. Poor circulation means that even small cuts or sores on your feet may heal very slowly. Over time, this can increase the risk of infection, tissue damage, and in severe cases, the need for amputation. If you notice this kind of pain, do not ignore it. Speak with your doctor as soon as possible. Simple changes like quitting smoking, staying active with gentle exercises, and improving blood sugar control can help support better circulation and protect your legs and feet. Now, let us talk about something just as important as recognizing the warning signs: how to care for your feet every single day. Daily foot care is one of the most effective ways to prevent serious complications like ulcers or even amputation. Start with a simple habit. Check your feet every evening after removing your shoes. Look closely for cuts, redness, swelling, blisters, or any changes in the skin or nails. If you cannot see the bottom of your feet, use a mirror or ask someone you trust to help. Wash your feet daily using warm water and mild soap. Always check the water temperature with your elbow first to avoid burns. Dry your feet carefully, especially between the toes. Apply a thin layer of moisturizer to keep the skin soft, but never between the toes, as excess moisture can lead to infection. Trim your nails straight across and smooth the edges. If your nails are thick or hard to manage, seek help from a specialist. Always wear clean, dry socks and well-fitting shoes. Never walk barefoot, even at home. And remember this, do not wait for your next checkup if something feels wrong. If you notice a wound that does not heal, redness, swelling, or signs of infection, contact your doctor immediately. Early care can make all the difference. As we come to the end of this video, there is one important message to remember. Protecting your feet starts with protecting your overall health. Keeping your blood sugar, blood pressure, and cholesterol within a healthy range is one of the most powerful ways to prevent complications. These numbers may seem small, but they play a big role in how well your nerves and blood vessels function over time. A simple and balanced lifestyle can also make a real difference. Choose nourishing meals. Stay active with gentle exercises like walking or swimming, and keep your body moving each day. These small habits, when done consistently, can help support better circulation and long-term health. And if you smoke, this may be the most important step you can take. Smoking reduces blood flow to your feet and greatly increases the risk of serious complications. Remember, it is not about doing everything perfectly, it is about making small, steady choices each day. Your future health is built on what you do today.